Hi friends, this is Dr. Apurv Mehra, and when I was asked to make this video on the scenario on 2023, I had some doubts in my mind. The first doubt is that a student will ask me that what's going to be next. NEET or next, right? And the second question will be when the exam will occur. So when I look at the first question, right, and when we look at the history of entrance exams, which get you a postgraduate seat in India, the exam is considered to be the most relevant for a person who is finishing internship or is a post intern. These exams, right, only can predict what happens next year when they give the exam for final years who becomes an intern in the subsequent year. So, like example, when I was doing my internship and the All India took place, and that was one of the very tough All India exams, and they were called it All India at that time, which converted into NEET in 2012. So we were very curious what type of questions came, and we were also very excited about the results, how it came in our college, and we kept on seeing what was the approach used by by the seniors, and we will often go and talk to them. And there were some things which were very common during that time of guidance. At that time, the images were not so rampant, and it used to be mainly a theoretical paper with the balance between the clinical scenarios, single liners, and some long questions. And but that paper just blew our mind off when I was an intern. And I'm talking about All India 2003. So if you look at that paper, it was just very difficult one. And but our college got good results, and we came to know of some basic things. Some basic things which were told to us by our seniors were that do last 3 to 5 year papers. Practice MCQs daily and have a plan for revision. So at that time, we used to make our own notes, make our own registers. The MCQ books were not the bundles that are available now, they were very few. And that's why the 3 to 5 years papers were done. These 3 to 5 years papers were followed to select the topics. And this was called as a retrograde study. Retro. They used to say retro padna. At that time, there was a word called as antegrade study also. Read the topics and do their questions. And I think the world of MCQs was evolving, right? Over 2003 to 2011, where the second paradigm shift occurred, right? The antegrade study almost stopped existing. And the only thing which was left was the retro. So looking at the questions, and you will rarely hear people talking about 10 years, 5 years, but by 2012 we had practically come to last 3 years papers. But yes, what has changed in last 2003 to 2012 were more MCQs and better ways of revisions, because mind you, there was the entry of lot of smartphones and lot of social media platforms like Facebook and WhatsApp, and they were empowering everybody with the skill of keeping the photographs and making the folders. We were becoming more user friendly with different Facebook groups which started teaching us, right? And many of the teachers, they started creating their own groups. It was also a time period where starting from different teachers, the individual lectures started taking place in India. And that started student teacher interactions. And the guidance was very clear. That was an era, the guidance was very clear. And this feature of MCQs daily was being told by 2 to 3 hours every day. And these revision modules came out to be a notebook which was called as a 20th subject note, because 19 subjects are in entrance exam, and in one notebook you will compile everything, right? And the more and more books started coming up, right? What exactly happened when NEET entered in 2012? There were different sessions, there were multiple papers, the equations changed, which went on for multiple years, finally, when it became a single paper. When it became a single paper after about 3 to 4 years of experiments, we realized that the paper was more of practical, what was seen in the different profs. It was more clinical, which was seen during the internships. It was more integrated, which was being observed from the first year to second year to the final years. And the images, they started becoming more and more. So if I look at the paper of 2018 and 2019, I will say the images were boomed up. A lot of them increased. And 2020-21, these images have actually gone down, but they are more predictable. The numbers have gone down, but the relevant and predictable images are coming on. So what exactly is happening here? What exactly is the message for the people who are going to be in internship in 2022? Whatever may happen in 2023, whether you're writing NEET or next, this is the exam by which you are going to qualify for a postgraduate seat. The exam will most likely take place in the beginning of the year. It always used to be second Sunday of January, the normal NEET exam. And that's the time, the second weekend of January is the time when you might have the NEET exam or the next exam, whatever they plan to keep. That's the usual pattern. What changed in 2003, 4, 2011, 12, and then when again it came back to single NEET exam, was that these last 3 years, these daily MCQ practices, these notes of revisions, and the images, they were all the same. They have not changed in last 20 years of me having a look at different exams. From the time I first gave it, when I started teaching, when I kept on seeing the changes. And a student can only not get selected if he follows the basic salt in the food. And the basic salt in the food of entrance exams are last 3 years papers and their topics, practicing MCQs daily and their mock tests on a routine basis, having a plan ready for revision, and having images with you. The only thing that will vary for the final years, for the interns, if it's a NEET, it's going to be single day, one paper, one session. If it is the next, it might be multiple days, multiple session. When I believe it's somewhere going to be in the January. You'll come to know about it. We are in the pandemic still, but this is what is expected. So this is the next, whether it's NEET or next, the rules don't change. So if you are an intern sitting right in the month of February, you have one exam to crack. That exam is going to get you seat. That exam can be 1 day or that exam can be 3 days. That's a different thing altogether. If it's a 1 day exam, the classical NEET, your plan is 3 years. There are topics which you will see from the videos, the snapshots or the revision of the images, your rapid revision or any other method that you feel is better, and your mock test and grand test and their timings. That's your formula, and I have created a video which I have explained the how, the what, and the why for preparation of any exam. I will tag that video just beneath this video. But if it goes to next, how does the plan change? If it is a next, they say the exam is planned for 3 days. Day 1, day 2, day 3. They will have a morning session. They will have an evening session. In the morning session, there will be 120 marks. In the evening session, there will be 60 marks. On day 1, they have divided this into medicine plus derma and psychiatry. On the evening of this day, they have combined with pediatrics. So it's all medical. On day 2, you will have surgery, you will have ortho, you will have anesthesia. It's combined with ENT. In day 3, they have gynae ops along with radiology, and they will have ophtha. This is what they plan, right? And looking at it, it appears that this is a building in air and there is no foundation within, right? So just to make the things clear, they have made it very ambiguous but clear. So how ambiguous? They haven't told you what will be there in first and second prof, how PSM will play a role. But they have made it clear that your 10% of the paper will be from first plus second year subjects, and 10% will be from PSM. So if I take here total, these are 540 questions. So 54 questions come from PSM and 54 they come from first and second year. But these percentages and these figures, right? My suggestion is that they will not be followed. My suggestion is it's all going to be a mixed, right? And I will say that you must just study the classical way. Do not even think in your wildest of dreams to ignore PSM, Path, Pharma, Micro, Forensic, Anat, Physio, Biochem. Right? It might appear in the NMC bill that it's going to be 11 subjects game, but these 11 subjects have no standing without the 8 basic subjects I have told you. But there are few things which I feel that you will find will keep on happening, right? Number 1, I expect there will be a lot of anatomy in these zones. A lot of anatomy in these zones. This is what I feel. I feel there is going to be a lot of physiology in these zones. And similarly, I expect there will be a lot of biochem here. These are the areas. So you will have a lot of questions which are overlapping, and you cannot separate out. Even a teacher cannot separate out it belongs to which subject. I expect there will be a huge proportion of pharma coming on to the subjects like medicine, psychiatry, anesthesia, gynae-obs, and to an extent, orthopedics. I expect pathology will play a major role in surgery, in ortho, in ENT, in ophtha, and there will be relationship coming up in radio diagnosis as well. Apart from path, I believe Robbins itself covers 10 to 11 subjects, and you will see the glimpse being shown into almost everything. You will have pathology in derma, you will have almost everywhere. So it's not going to be something that you can escape. And path and medicine, if you look at the integrated videos that Dr. Deepak Marwa sir and Dr. Sparsh Gupta makes, itself shows that actually we should write them in double colors. Right? And then micro, I believe that you will not be able to answer any question of medicine without micro. Ortho is micro. Peds is micro. ENT is micro. Ophtha is micro. Gynae-obs is micro. Surgery, a lot of micro. It's always there. So you tell me an area where you won't find micro. So actually you will find micro almost everywhere. And friends, then comes forensic. Forensic itself will have huge proportion, right? And it's one of the subjects which has been very high yielding. They will mix it up. And if you observe carefully the last third part, the gynae-obs and radio area, that's an area the PSM will creep in a lot. But anyways, PSM is going to be 10% straight. So you expect huge number of questions coming up. So finally, it's going to be a rainbow where violet, indigo, blue, green, yellow, orange, red all have to be seen to appreciate the beauty. And that's what medical science is. It's been built with a purpose. You learn preclinicals, paraclinicals, final year part 1 and then final year part 2. So we are going to have these points and these questions almost everywhere. And there will not be a place where this overlap does not exist, right? I'll give you an example just for a clarity, right? If in the exam you get a tumor of lower end of radius going right till the joint goes till the joint, right, and eats up the bone, it's called as a giant cell tumor. They can ask an image, it will become a radio question or an ortho question. They can ask an histopathology, it will become a patho question. They will ask a treatment, it will become an ortho question, right? So, how will you separate it out? It's always going to be like this. It can come from the knowledge of paraclinical to ortho to radio, and there'll be a lot of overlap. So, it's all going to be focused on the three things that started happening in 2018, 19, 20, 21. And the three things were the practicals were more asked, the colors of the cannulas, the size of the Foley's, the numbers of the blades, the name of the splints, common practical things that you see were more asked. They were trying to link up clinical and pre and paraclinical subjects together, but they were asking you long statements with multiple lines. And they were using an integrated approach. They were trying to integrate different subjects so that you arrive at the diagnosis and further management. And that's what they claim. They claim that a person, a student who is appearing in next should be a person who should be able to think. He should have a problem solving approach. And majority are these, means they will be asking you questions as being asked in MLE. So they're going to ask you that a person comes to an emergency and these are his findings and what will you do next and what next and what next and what next. So they are going to talk to you whether you are practically being capable of handling a real life situation. So they are going to take up doctors who are going to save more lives and decrease the disabilities. So they are going to judge this problem solving approach in the MCQs. They are going to talk about your ability to analyze, assess, and tell what these graphs mean, what these images are showing, right? It means that they're going to select people who have in-depth knowledge, and that's about 30% of your questions. And just last 10% they will talk about the datas or recalls, which are single liners or very easy to crack. In fact, I have an opposite opinion. I believe that the longer questions are easier to crack because they have multiple single liners, as compared to a single liner which doesn't give you much options. You know it or you don't. So they are going to create a balance between people who understand, who apply, and who remember. So problem solving is understanding, analysis is applying, and recall is remembering. So these are the things that they're going to look into. So if I am an intern, I give next, let's assume that. I will get a rank and I will take a seat. I have a single next called as the next one, which is actually meant for the final years at the end. But in 2023, the interns of this year who will give next one, they won't have to give next two. Obviously, they start joining because their internship is done. Subject to final announcements, but this is what we understand. Friends, if I am a final year, do I wait for any announcement? I should not. I must start approaching and understanding whatever final year subjects I'm reading. I should be ready with the MCQs. I will be appearing for next one. My list will be separate. It cannot be the same as the one which is for the interns. And this separate list will get me a seat in 2024 at the end of internship when I clear next two. Again, subject to the announcements. We'll come to know about it after NEET 2022. But this is what it means. The summary is again the same. Last 3 years topics. They are MCQs. The images. Plan for revision. Giving previous test. Staying focused. Decrease your distractions, because this year is going to bombard with lots of videos on this. I don't know, my video might be the 1000th video on internet regarding next 2023. But still I feel that I'll give you an honest opinion. It hasn't changed in the last 2 decades. It won't change. These rules have been the rules forever. So my suggestion is, do not waste your time. Pick up your books. Pick up your notes. Pick up your pen and focus on this, whether it's NEET or it's next. A student who's well prepared with these things in his mind will finally do well. Remember, they will ask you practical things. Remember, it's going to be integrated. They will ask you clinical applications. And remember, somehow it's an observation. The new exams, they start getting easier. Go kill it. Thank you very much.